Hi, it's Dr. Jenny here, and I want to talk on this video about an underactive thyroid. So I get people that I see in my practice all the time that are wondering if they have a thyroid problem. Maybe they've been told they have a thyroid problem, maybe they just think they have a problem with their thyroid, or they feel they have all these symptoms. And let's talk about what that feels like to somebody. It feels like you're cold all the time. It feels like your hair is starting to fall out. Depression, joint pain, an inability to lose weight, low energy, brain fog, all of those things. So when people hear those things, they think maybe it's my thyroid. And it could be, but those are also symptoms of other things too. So just because you have those issues doesn't automatically mean it's your thyroid. It just means that it's a good place to look. And how do we know if we have an underactive thyroid? I would say the biggest thing that I see a need for is a really good evaluation of your thyroid. So if you go to your primary care doctor and you say, I wonder if my thyroid's an issue, they might run one or maybe two labs if you're really lucky and they put an extra number on there for you. Then you get a little bit of information, but it's like the very, very tip of the iceberg. They run one little lab number and it's called a TSH level, or a thyroid stimulating level. And all that does is tell us whether your body is sending a message that it needs more thyroid hormone. The problem with that is it's only one marker, and there's several others that I think we really need to have clarity around what the thyroid is really doing. And it is late to respond. So you can have a thyroid problem that's been going on for a while, that it's not showing up on that lab because that lab takes a while to change in response to some other things that you can look at to see earlier on what is going on with your thyroid. The other thing that you'll find with that number is that the reference range that the labs use is, in my opinion, and every other functional practitioner that deals with the thyroid will tell you this too, the range that they use is just, it's not helpful. They have this huge range of anywhere from 0.5 to 4.5 or even higher on this lab. And the truth is that most people feel better in a very narrow, tightly controlled range between about 1 and 2. So here you've got 1 and 2 is where you feel good, but the lab says 0.5 to 4.5, everything's good. And I see this all the time. People come in and they've been told their thyroid looks fine, and we dig in, we run the rest of the story. Maybe we do some other testing that isn't, called thyroid testing, but it's related to the thyroid. We look for nutrient deficiencies, we look at gut health, adrenal hormones. All those things really, really play into thyroid health. And sometimes the problem isn't on a thyroid number, we see it somewhere else, and we know, hey, this is affecting the thyroid gland, and here's how that's doing it. So I would say, to answer that question, do you have an underactive thyroid? I would say the only way to know is to get a proper evaluation and talk to someone who isn't going to just throw thyroid hormone at the problem if you do discover that's the problem. Because in my opinion, and I treat a lot of thyroid issues, like support and help encourage good health for the thyroid, is my experience is, in a lot of cases, the thyroid has changed secondary to something else going on, like a nutrient deficiency or a gut problem, an immune problem, an adrenal problem, another hormone affecting the thyroid. So things like that. So just because your thyroid is underactive doesn't mean that is the way that you recover your health is taking a thyroid hormone. It could be digging in and finding the root cause. So I hope you found that helpful. I just think there's no substitute for having good information that looks at a TSH, a T4, a free T4, a T3, a free T3, a reverse thyroid, the TPO and TG antibodies, reverse T3, and T3 uptake. So you can see how that list of markers differs widely from one marker called a TSH. So we're looking at a whole different set of information so we get more clarity on what's really going on with the thyroid.